Hey friends, today our topic of dental discussion is dry socket. Before that, we will learn why a blood clot after tooth removal is so important. What happens when this clot is lost? The causes, symptoms and management of dry socket within a very short period of time. Now let's see. Normally, after a tooth is extracted, bleeding occurs in the empty socket. This bleeding stops by forming a clot, which is very important for proper healing. The functions of clot. It covers the exposed bone and nerves, means it protects the sensitive socket from the stimuli like air, food and touch, which causes pain. Means the clot reduces pain. Second point is acts as a natural dressing as it prevents the continuous bleeding from the socket. Third is prevention of infection. And as clot contains the immune cells that protect the wound from bacteria. Fourth, foundation for healing. It acts as a scaffold where new tissues means granulation tissues forms. Fifth is prevent the food entry, stop the food particle from getting lodged in the socket. This will also prevent the secondary infection chances. Now, let's come to the topic. What is dry socket? Remember, if a tooth is removed and its blood clot dislodged or get removed from the socket, a bare bone and a bare nerve remains, which causes the severe pain as shown in this picture. Now see in this picture, there is a removal of blood clot. Now bare bone is seen and bare nerves are present there, which whenever we are going to apply the smallest stimuli, it will causes a magnified pain. That's why in dry socket there is an excruciating level of a pain to the patient, unbearable. Most commonly, what are the causes of dislodgement of this clot from the socket? These are spitting, gargling, smoking, drinking with straws. All these activities causes the negative pressure development inside the mouth and clot get dislodged. So the symptoms, patient comes with severe throbbing pain 2 to 4 days after extraction. Now remember, after normal extraction, day by day the discomfort and pain of a patient get reduced. But in this condition, patient complains that after 2 to 4 days of extraction, I am having such type of pain. Pain radiating to ear, eye, temple or the neck on the same side. Now on clinical examination, there will be the empty socket with exposed bone. Patient complains of foul taste and breath. Delayed wound healing is seen. Now come to the treatment and management. First upon, if there is need, go for the local anesthesia or topical anesthesia. After that, irrigate the socket with saline. After irrigating with normal saline and removal of all the debris, place a dry socket dressing. These are the commercial dressing available in market. And best is what? Your zinc oxide eugenol paste. Mix it and just place inside the socket. Prescribe some analgesics and antibiotics to get rid of infection and to avoid the secondary infection. Ask patient to keep Good oral hygiene. Change dressing after every 3 days. Maximum duration of dry socket in a patient is up to the 10 days. Educate patient well. Thank you.